Mr. Speaker, we had expected that Budget 2019 would have been the oil and gas budget. But it seems that after more than 4.5 hours, it was more gas than budget. After more than 35,430 words, the Minister of Finance has failed to convince us why anyone in this country should support this budget. So far, his colleagues have been just as uninspiring, with a lot of policy incoherence, a hodgepodge of plans, and big taxes to burden the poor working people of this country. It seems the underlying thrust of this budget can be broken down in these letters, B, T, and S. That is, borrow, tax, and squander. Needless to say that this is a recipe for economic disaster. As responsible members of this House, we must interrogate and expose the false promises, the failed policies, and the waste of taxpayers' resources. Mr. Speaker, let us examine the health sector. The allocation for health as a percentage of total GDP has been in steady decline. Appendix 2 of the budget speech illustrated that in 2014, the last full year of the PPP, the health and social services sector was 1.94% of total GDP. In 2019, it has dropped to 1.886 of the total GDP. In the last 4 budgets, the government has allocated more than $100 billion. But the big question is, are we getting value for the monies that they have expended? Yes. And the simple answer is yes. A resounding no. Yes. Mr. Speaker, one of the critical areas of government waste has been the inefficient and corrupt procurement practices. Minister Cummins, in her 2018 budget speech, boldly asserts that we have toiled and wrestled with the beast called procurement, and under the sagacious watch of my colleague and comrade, the Honorable Mistress Valda Lawrence, procurement at the Ministry of Public Health has been brought under control. These industry best practices are not designed to slow things down, as they are implemented to practice good governance and leadership, mixed with accountability, fairness, balance, and transparent deliverables through and through. And that's the end of the quote. Mr. Speaker, these are indeed beautiful words that cannot cover up the stench of corruption at that ministry. I notice that Minister Cummins this year stayed far away from the theme of procurement. Instead of praising her senior colleague, she stayed even further on these procurement issues. Moreover, we are left to wonder why. Why didn't she talk about procurement this year? But perhaps the answer can be found in the Auditor General's report of 2017. It seems that the Ministry of Public Health has been guilty of breaching almost every section of the Procurement Act. In paragraph 538 of the AG report, the ministry was guilty of single sourcing. 13 contracts totaling $91.422 million awarded through single source procurement method. Single sourcing, as we know, Mr. Speaker, can lead to higher prices for the items because the vendor has a monopoly. How much extra has been paid is still unknown, but conservative estimates show that it has been in the millions. Mr. Speaker, there are other flagrant breaches of the procurement law, such as contracts valued at $278.5 million, awarded without bid security, and that can be found at paragraph 542 of the AG report. Mr. Speaker, another case of single sourcing of drugs worth $104.1 million. But this one, Mr. Speaker, has a twist, and that is 6 contracts were awarded without the approval of the tender board. The tender board was asked to rubber stamp the transactions after the deliveries were made to the suppliers. The ministry was also actively engaged in contract splitting. Paragraph 590 of the AG report. And this is what the AG had to say. 11 contracts totaling $82.5 million was awarded by the Ministerial Tender Board to 4 contractors. And given the value of the contract, it would appear that these contracts were deliberately subdivided to avoid submission to the National Administration and the National Tender Board. Mr. Speaker, despite these transgressions, when you go back to Minister Cummins' speech, she was totally unfazed. And she bold-facedly then said that the people of Guyana will not be allowed to suffer because of procurement issues at the Ministry of Public Health. May I sound the bell? Any deliberate attempt to stymie the procurement process at the Ministry of Public Health will be met with the harshest of penalties, which would be applied to those concerned condignly and with extreme prejudice.
She needs to send herself to jail.
Indeed, the bell has sounded, but malpractice in procurement continues unabated at the Ministry of Public Health. Mr. Speaker, we now have the infamous case of HDML Labs, where millions and millions of dollars were lost. And to refresh our memories, the tender board gave approval for restricted procurement to 6 suppliers. HDML Labs was one of them. 3 companies tender in the first round. HDML Lab was not one of them. And then, when they went to the evaluation, what happened? All 3 companies that tender were deemed non-compliant. But just months before, these very companies were awarded contracts by the ministry and by the Georgetown Hospital. But 1 or so months after, they were deemed non-compliant. Again, they went back to the National Tender Board, and they were allowed to do restrictive tendering, again with the same set of suppliers. And this time around, magically, only 1 company tendered, and that was HDML Labs, the only person to tender. And Mr. Speaker, And Mr. Speaker, HDML Labs was awarded the contract at $409.49 million. And we know that this House was told initially that the contract price was $366 million. But when the contract was really audited, then we saw how much more was given to this company. But what was even more important, Mr. Speaker, when we compare the prices between those people who were rejected and this company who actually got the bid, the prices are startling. The gap between what was rejected and what was given to this company is a huge gap. In fact, the lowest bidder in the first round of tendering would have given us all those drugs for 190.6 million Guyana dollars. But HDML was awarded it for $409.497 million. This is what we are talking about. This is how our monies are being squandered and wasted in this country. But, Mr. Speaker, these examples, nothing was spent. So what assurances do we have that when we put this money in here for this year or for 2019, that after so many years of procrastination by this ministry, that we'll now have this needed facility being built? But, Mr. Speaker, there are many, many more infrastructure projects like this where there's total incompetence and mismanagement. But, Mr. Speaker, let us come to another area. Outsourcing. Outsourcing of storage seems to be now big business in the Ministry of Public Health. Minister Lawrence, in her last budget, proudly declared storage bond at Kingston and Diamond, no more renting. However, the Auditor General's report tells a different story. Sussex Street Warehouse, Mr. Speaker, $137 million paid from February to December 2017, and then contract dated from the 1st of June 2016 and signed on the 20th of June for 3 years. While the landlord was sent a letter to quit, what happened? They ended up paying $25 million from November to December 2017. And when we thought this was over, they paid another $100 million for January to August 2018. Mr. Speaker, it is extremely difficult to make up this stuff. Perhaps we should make it and make a movie called Warehouse One. We should have this movie called Warehouse One, this Sussex Street drama starring George and Valda, costing Guyanese taxpayers more than $250 million and counting. Mr. Speaker, and then there's a sequel called Warehouse 2, the Princess Street edition. This is now a new off-site storage space that the Auditor General has now discovered. The place is so secret that the Auditor General was not allowed the information on the location, the size of the space, or where it is, and how much we are paying in rental. But this, of course, Mr. Speaker, is costing the Guyanese taxpayers millions and millions of dollars. Mr. Speaker, and if Warehouse 2 was not good enough, the this warehouse series seems to be a lucrative business, Mr. Speaker. The ministry has now produced another one called Warehouse 3, Ocean View International Hotel Edition. Perhaps we should rename it Drugs, Termite, and 7 Hotel Rooms. Again, what we should do is try to find out the cost. How much of this extravaganza is costing us? Let us assume, Mr. Speaker, that one hotel room costs $60 US. Then 60 multiplied by 7 would give us $420 US per day, which would mean 12,600 US per month for these rooms. But you know what, Mr. Speaker? You know what, Mr. Speaker? We hope that the Minister of Public Health would clear the air and come clean and tell this National Assembly how much it is costing us. Mr. Speaker, it is cases like this that has resulted in the Bank of Guyana being overdrawn on the public deposit account by some $48.5 billion. Mr. Speaker, at the rate this government is going, it is pawning the future of our young people by its policy of taxing, borrowing, and squandering. This, Mr. Speaker, reeks of old school PNC type economics that would eventually lead to bankruptcy. Mr. Speaker, APNU AFC manifesto for 2015, it says strengthening the delivery of primary health care services to promote greater integration of services in general, including environmental surveillance to meet the needs of remote communities in particular. In just 3 years, there are clear signals or signs of failure in the public health sector. Anyone who has recently utilized the system can attest to its failings. Long waiting times at outpatient clinics, longer waiting times for surgery, unavailability of diagnostic tests, constant shortages of drugs have plagued the system. And Mr. Speaker, as if this is not enough, admission to the GPHC now is like a lottery. Patients have to hope that when they get sick and go there, that there's a bed that is available. In some cases, people have to wait in the accident and emergency for days on end to get a bed up in the ward.
Honorable members, every member who stands, every member to whom I give the floor will make the statement he or she wishes to make. We can either allow the member to say it, or we can interrupt the member infrequently, and then we have a situation in which the member is on the floor an hour to deliver a half an hour statement. Or we can allow the member to make his statement, and if we feel we must interrupt with discretion. There is no reason trying to shout the member down. I will allow the member to complete his statement if it takes 2 hours. So let us be clear as to what we will do here. Please proceed, sir.
Thank you very much, Mr. Speaker. Mr. Speaker, but maybe the honorable members on that side would probably not know of the conditions of some of our hospitals because they do not utilize the facilities in that we have.
Honourable member, you have 5 minutes remaining.
Thank you, Mr. Speaker. Mr. Speaker, the Honorable Minister Jordan, speaking on tuberculosis, pointed out an increase in the incidence of multi-drug resistant strain of the disease. Yesterday, Minister Cummins confirmed multiple drug resistance, but what she did not tell us, or what she did not explain to us, was the reason why we have multiple drug resistance TB in Guyana. Mr. Speaker, the experts will tell you that multi-drug resistance TB developed because of program failures, because they have been stuck out of critical drugs, inadequate monitoring, poor compliance, and sometimes patient poverty. Many of these patients are too ill to work, and with the paltry sum set aside for public assistance, when they do benefit, it is hardly enough for them to survive. Yesterday, the Honorable John Adams sought to placate this House by stating that some functionaries of the ministry stated publicly that there is no shortage of TB drugs. However, Mr. Speaker, what he failed to tell us was that when did those drugs arrive in this country from the global TB facility? Before that, there were shortages, and that is why you are having program failure. But, Mr. Speaker, distorting the truth is probably good for propaganda, but critical shortages of drugs are going to hurt and kill people. Stop playing with the lives of people in this country. Mr. Speaker, just a few days ago on the 1st of December, we celebrated World AIDS Day. And under the PPP government, tremendous strides were made in fighting this dreadful disease. We note that the disease is on the increase in certain age group. Mr. Speaker, the adult prevalence rate is 1.7%. And when we look at the high-risk groups, it's even higher. So, for example, among sex workers, it's 6.1%. Among transgender people, 8.4%. For high-risk population groups, one of the most effective ways of preventing this disease is for us to introduce prevention exposure prophylaxis. I urge the government...
Remember, you have 2 minutes remaining.
Thank you, Mr. Speaker. I urge the government to urgently implement this most effective way of preventing this disease in the country. Mr. Speaker, the government likes to talk about bills are just the tip of the proverbial iceberg. If the government likes to be taken seriously, then they should take actions against these transgressions. It is not only about sounding the bell, as Minister Cummins told us, but it is now about belling the cat, and that is what we would like to see happen. Mr. Speaker, from 2015 to 2017, the government expended vast sums of money to buy drugs and medical supplies. Many of these contracts were made as an emergency, so that the delivery had to be time-bound. And they had to be time-bound because there were shortages in the public health system. So they were going out to emergency, bringing in the goods so that you can fix the problems in the system. And if that system had worked, that would have been good. Patient care would have improved. But what is unbelievable, Mr. Speaker, is that more than $345 million dollars were paid for drugs, but it was not delivered. Mr. Speaker, in 2015, the ministry is yet to receive $144.6 million worth of drugs that has already been paid for. Fast forward to 2016, again, $67.78 million worth of drugs that was paid for but has not been delivered. And then we come to 2017,
Good Lord.
$133 million of drugs that was paid for but has not been delivered.
And people need it. That's the problem.
Somebody need to explain what is going on in this Ministry of Public Health. And Mr. Speaker, I'm sure in 2018 we'll have drugs that have not been delivered. This type of situation, Mr. Speaker, where right now there are shortages of drugs in almost every health facility in this country. In every health facility, and I repeat that for emphasis for the minister, because if she goes around to the various health centers, she would know that. So don't come here and pretend that there aren't shortages. Right now at the Georgetown Hospital, there are shortages. You go to any one of the health centers and we can identify shortages. So don't come here and try to tell us that there aren't shortages. We know differently. We know differently. And more so, what is important is that the patients in this country knows differently. Because when they go to the health center, they cannot get drugs and medication. So don't come here and pretend. But Mr. Speaker, what is also interesting, Mr. Speaker, is that many of these favored suppliers of pharmaceuticals, many of these favored importers of pharmaceuticals does not have license to import the pharmaceuticals in this country. Many of them are not registered with the Food and Drug Administration. And if the minister would like to dispute that, well then, as I asked her in the last budget debate, she should bring those registrations to this Parliament.
This Parliament.
Last year I asked for that, and up to now, 1 year after, we still cannot get a single document produced here to show that these importers actually are registered. Something is definitely wrong in that ministry.
Honourable members, it would be helpful if we do not all try to make a statement at the same time. As the honourable member is making, it is his turn to speak, and we should allow that to take place without undue
Speak on, Frank. Speak on.
interruptions. Thank you. Please proceed.
Thank you very much, Mr. Speaker, for your protection. Mr. Speaker, this situation that we have with importers not being registered, with drugs not being compliant with the national standard, with the quality not being there, Mr. Speaker, this is a total breach of the Food and Drug Act, and we should not allow this to continue. Mr. Speaker, one of the things that we know of the Ministry of Public Health is that they have a flagship program. And that flagship program is the construction of its new head office. However, instead of this being a flagship, it has become emblematic of incompetence and mismanagement. In the Auditor General's report, paragraph 573, a contract was signed for the construction of phase 1 of the head office building for $365 million. The contractor received payment of $71 million, representing 20% of the contracted sum. However, as of the 13th of August 2018, what do we find? There have been significant delay in the completion of works. A few piles have been driven, and when they went to verify what was going on, there were 2 workers from the contractor on site. The site office, 9 months after this contract was signed, they still was in progress of making the site office. Mr. Speaker, this must be a national embarrassment. But despite the incompetence, despite the mismanagement, this year in this budget, we are earmarking another big allocation of $438.9 million to continue this project. As far as I'm concerned, Mr. Speaker, there's need for an independent investigation into what is happening with this contract at the Ministry of Public Health. Mr. Speaker, and it's not only happening in the Ministry of Public Health. It seems that the Ministry of Public Health, they have a special gift for mismanagement. Let us look at the Diamond Hospital. Upgrading works at Diamond Hospital. A contract sum of $21.4 million was given for the works for the Diamond Hospital. What happened? Unapproved additional works, that is variation of works, amounted to $18.2 million. The revised contract now has moved from 21 to $39.7 million. But guess what? The ministry paid from this contract Mr. Speaker, of the $39.7 million, they paid $38.2 to the contractor. But here is the punchline. They did not receive any approval from the National Procurement and Tender Administration for the variation of work or for the increased contract sum. This is how this ministry is being managed. There is no documentation or breakdown or details of these additional works. And this is what we have going on in this ministry. Mr. Speaker, and then you have another bit of capital works. And like a recurring decimal, the doctor's quarters at Port Kaituma Hospital Complex is once again on this year's budget. Last year, when it was on, or this year, we budgeted $23 million. But guess what happened? Nothing was spent. Its commitment to treat all. But what has happened? We were told we have 8,200 persons living with HIV in this country. And right now we are treating approximately 5,237, which leaves a gap of 2,963 patients who are still without medication. Mr. Speaker, I urge this government to match its rhetoric with action. Let us put in this budget the amount of money necessary so that we can scale up treatment for these patients who have HIV. Mr. Speaker, diabetics, there are 60,000 in this country. What we hear is how much we want to prevent non-communicable diseases. But you know, Mr. Speaker, one of the things to prevent or to help patients who have diabetes to manage their sugar is to get a glucometer. It costs about maybe $5,000. And you know, if we take the money that we had wasted on Sussex Street bond, we could have bought about 65,000 glucometers and give it to those patients.
Monitor their sugar.
Mr. Speaker, suicide, that seems to have taken a back burner. But a report that I was reading from the mental health unit of the ministry, one of the things that it said is that the workers in the mental health department now cannot go out and help patients because they don't have transportation.